Living with pain that won't go away can be incredibly difficult. When that pain is in your pelvic area, it can be confusing and isolating. This condition is often called chronic pelvic pain syndrome, or CPPS. For men, it is frequently referred to as chronic prostatitis. But it's important to understand that this isn't always an infection of the prostate gland. In fact, most of the time it's not. Instead, think of it as a persistent long-term pain signal that gets stuck in the on position. This pain lasts for at least 3 to 6 months. It involves the muscles, the nerves, and organs in the lower part of your torso, below your belly button and between your hips. This condition is not a single simple problem. It is a complex puzzle with many different pieces. The pain can come from various sources within the pelvis. It might involve the bladder, the bowels, the reproductive organs, or the muscles and nerves that support this entire region. Because of this complexity, doctors sometimes struggle to pinpoint one exact cause. This can be frustrating for patients who are just looking for a clear answer and a quick fix. What we do know is that the nervous system often becomes oversensitive. It starts sending pain signals to the brain even when there is no new injury or infection. It's a bit like a faulty car alarm that keeps going off for no reason. This is not a reflection of your personal strength or weakness. It is a real medical condition. Advanced imaging and a better understanding of the nervous system have shown us that chronic pain creates real, measurable changes in the body and the brain. The pain you feel is genuine. Acknowledging this reality is a critical part of the journey toward healing. You might be surprised to learn how common chronic pelvic pain is. It affects people from all walks of life. While this essay focuses on the condition in men, often called chronic prostatitis, a similar condition affects millions of women as well. It does not discriminate based on age, race, or profession. It can affect young, active men in their 20s and in their 30s, just as it can affect older men. It is estimated that chronic prostatitis or chronic pelvic pain syndrome affects a significant portion of the male population, with some studies suggesting up to 10 to 15% of men will experience its symptoms at some point in their lives. Because the symptoms can be vague and sometimes embarrassing to talk about, many people suffer in silence. They may feel isolated, believing they are the only ones going through this. But the numbers tell a different story. This condition is responsible for millions of doctor visits each year. It is one of the most common reasons a man under the age of 50 will see a urologist. The feeling of being alone is a heavy burden, but it's important to know that you are part of a very large community. There are certain factors that might increase a person's risk. Previous infections such as a urinary tract infection or a true bacterial prostate infection can sometimes be a trigger. Physical trauma or injury to the pelvic area, such as from a fall or an accident, can also set the stage for chronic pain. Even high levels of stress or psychological distress can play a significant role. Stress causes muscles to tense up, and in the pelvic region, this constant tension can lead to pain and inflammation over time. The journey into this condition is unique for every individual. The symptoms of chronic pelvic pain can vary widely from person to person. The most common symptom is pain. This pain can be felt in many different places. Perineum, the area between the scrotum and the anus. Testicles, the tip of the penis, lower abdomen and back. The pain can feel very different for everyone. A dull, constant ache, a sharp pain, a burning sensation, a throbbing feeling. Beyond pain, there are other challenging symptoms. Frequent or urgent need to urinate, even when the bladder isn't full. Pain or burning during urination. A weak or interrupted urine stream. A feeling that you can't completely empty your bladder. Sexual function can also be affected. Pain during or after ejaculation is common. Some men may also experience erectile dysfunction. These symptoms can be deeply distressing and affect intimacy and relationships. The impact goes beyond physical discomfort. It can be difficult to sit for long periods. This affects people with desk jobs and people who drive a lot. It can discourage physical activity and exercise because movement can sometimes make the pain worse. That can lead to inactivity and deconditioning. Simple pleasures can become sources of anxiety. Going out to dinner with friends, attending a movie, worrying about flare-ups or needing to be near a restroom. Living with this constant battle takes a toll on mental and emotional well-being. It's understandable to feel frustrated, to feel angry, or to feel hopeless. Many people also experience anxiety and depression. The condition can strain relationships with partners, with family, and with friends. It can affect your ability to work and your enjoyment of hobbies. That's why addressing the emotional impact is just as important as treating the physical symptoms. Your feelings are a valid part of the experience. The pain you experience is real, and so are the challenges it creates in your daily life. But there is hope, and there are effective ways to manage these symptoms and reclaim your quality of life. One of the most frustrating things about chronic pelvic pain is that, in most cases, we cannot find one single definitive cause. For years, it was thought the condition was caused by a hidden bacterial infection in the prostate gland. However, we now know that this is rarely the case. In over 90% of men diagnosed with chronic prostatitis, no evidence of infection can be found. The leading theory points to a combination of factors that create a cycle of pain and inflammation. This is often called the neuromuscular inflammatory model. Neuromuscular inflammatory. It might start with an initial trigger, minor injury, past infection that has since cleared, period of intense stress. This trigger can cause the muscles of the pelvic floor to tighten up and become tense, the sling of muscles that support your pelvic organs. This sustained muscle tension can, over time, lead to inflammation and irritation of the delicate nerves in the area. Once these nerves become irritated, they can become hypersensitive. This is a process called central sensitization. Think of it as the volume dial on your body's pain system being turned all the way up. The nervous system gets stuck in a state of high alert. It starts interpreting normal sensations as painful threats. Bladder filling up, pressure from sitting, these become red warning signals. This is why the pain persists long after the initial trigger is gone. Your brain and spinal cord have essentially learned the pain. They keep generating the pain signal even without a new cause. It becomes a self-perpetuating cycle that is difficult to break. Because there is no single cause, the condition is not curable in the traditional sense, like curing an infection with antibiotics. This can be a difficult thing to hear. However, it is absolutely treatable and manageable. The goal shifts from finding a cure to breaking the pain cycle and improving quality of life. Because chronic pelvic pain is a complex problem, the most effective treatment is usually a multifaceted approach. There is no single magic pill that works for everyone. This often involves a team of healthcare providers, including urologist, physical therapist, pain management specialist, mental health professional. The first step is often to rule out any other specific medical conditions. Medication can play a role in managing symptoms. Doctors might prescribe medications to help relax muscles such as alpha blockers. Anti-inflammatory drugs may be used to help reduce inflammation. In some cases, medications that work on nerve pain, like certain types of antidepressants and anticonvulsants, can be very effective. These are used in low doses not to treat depression but to help calm down the oversensitive nerves and turn down the volume of the pain signals. One of the most important and effective treatments is pelvic floor physical therapy. This is very different from the kind of physical therapy you might get for a knee or shoulder injury. A specially trained physical therapist will work with you to identify and release tension in your pelvic floor muscles through gentle manual therapy, both externally and sometimes internally. They will also teach you specific stretching and relaxation exercises that you can do at home. The goal is not to strengthen these muscles, but to teach them how to relax. Lifestyle changes and self-care strategies are also a huge part of the management plan. Simple things can make a big difference, like using a special cushion. Gentle stretching like yoga and Tai Chi can help reduce muscle tension throughout the body. Managing stress through techniques like deep breathing, meditation, and mindfulness is also critically important. Paying attention to your diet can help too, as some people find that certain foods or drinks can irritate their bladder and worsen symptoms. Caffeine, alcohol, and spicy foods are common triggers to be aware of. By combining these approaches, many people find significant relief and improved quality of life. Hearing that a condition may not have a simple cure can feel disheartening. But I want to leave you with a strong message of hope. While there may not be a single pill to make it all go away overnight, chronic pelvic pain is a highly manageable condition. Thousands of people have found effective ways to manage their symptoms and reclaim their well-being. The journey requires patience, persistence, and a willingness to explore different treatments. You are in the driver's seat. Become an active participant in your own care. Educate yourself. Ask your doctors questions. If one treatment doesn't work, don't give up. Be open to trying another. Build a supportive healthcare team that listens to you. Remember, this is a marathon, not a sprint. There will be good days and bad days. On bad days, be kind to yourself. Celebrate the small victories. A day with less pain, sitting through a movie, a short walk. These successes build momentum. Do not underestimate the power of support. Connect with others who understand. Online forums, support groups, talk to a trusted friend, family member, or mental health professional. You do not have to carry this burden alone. Sharing your story can be empowering and help others. Community is a powerful medicine. Chronic pelvic pain is real and challenging, but it's not a life sentence. There is a path forward, and there is absolutely reason for hope.